Hello, Scott Fleischman here with Gifford CMO, Dr. Josh Wake. We wanted to try to answer some of the questions and concerns that you may have out there. The Delta variant is active and it is causing cases to spike across the country.
Variants of COVID were expected. That's what biological organisms and particularly viruses and bacteria do. They mutate so that they can spread better. Normal and expected. In this case, what Delta seems to do is reproduce in a person much faster, and so you'll find viral loads are 1,000 times what they were back with the original COVID-19, which means when a person coughs or sneezes, there's a lot more virus in there and it's much easier to transmit. Estimates are 40 to 60% more. When we were looking at things like vaccinations, the original intent was to prevent unnecessary sickness, hospitalization, and death, and the vaccinations do that really well, which means that Vermont's target of getting 80% was a big deal and provides us some measure of relative safety. That doesn't mean we're completely free of COVID. There's still a lot of Vermonters that are unvaccinated, and it doesn't mean that as a vaccinated person you're completely safe from COVID altogether, because you can still get infected. Remember that I said that the goal was to keep you out of the hospital. And so we are seeing both unvaccinated individuals test positive for COVID, as well as the occasional vaccinated individual, although they tend to be a lot less sick. What that's going to mean for us in the future is that as there continue to be a lot of COVID cases, particularly elsewhere in the country and in the world, there's opportunity for further mutations. As those mutations occur, the vaccinations that we have are likely to become less effective, and so that relative safety barrier we have is going to ebb away. And we're probably looking at some sort of booster or revaccination in the future.
Should we be worried here, and especially in this area where we've done such a great job? Should we be worried right now?
I think cautious is the word I would use. I wouldn't worry. Vermont's done a nice job. The goals set out by the state, the populace responded to it. We did well. You're seeing that reflected. And so how much should the individual Vermonter be worried? Very little. We're in a good place. Could that change in the future? Yes, it could, and we'll have to respond to it. And we've demonstrated that we can do that and will do that, and I anticipate that will remain the same. I suppose if I had, big travel plans to, I was going to go to India in the near future, I'd be worried. But other than that, not so much.
Do you envision a time where we're going to go back to maybe a mask mandate indoors for even vaccinated people?
It's certainly a possibility. You measure the different opportunities for protection from a public health perspective, which include things like social distancing, masking, as well as vaccination. So it would not surprise me to see that coming down the pipe.
Do you think that there is a light at the end of this tunnel with the Delta variant? Maybe by fall things we see numbers kind of trend downward? If more people, especially if more people get vaccinated?
Depends on what you mean by light at the end of the tunnel. Globally speaking, I think we have missed the opportunity to put the lid on COVID. That's not to suggest that vaccinating the whole world is an easy task. So I don't know to what degree that would have been possible in the first place. I think we're looking at more than likely, particularly with even areas in the U.S. that aren't well vaccinated, something that becomes endemic. I think this is now part of our lives, and we're going to be looking at, boosters as we move along, areas that have a bigger disease burden and a lower disease burden, and it's just going to be a new public health challenge. Some level of masking and public health protections are part of our lives now. For a student of epidemiology, this is not surprising. This was coming, and this has been predicted by public health officials for a long time. With global travel, we live in a world now where disease can move around really fast. Back in the initiation of this country, it took ships coming across the Atlantic to bring smallpox to the Native Americans, and that was a matter of months. You can now move continent to continent in a matter of hours. Hopefully not in the near future, but this won't be the last pandemic either.
You mentioned boosters and possibly another vaccination shot there's reports that there will be a booster shot available right around the start of fall for our aging population, people who are susceptible, may be more susceptible to getting the virus. What do you recommend?
The data on that is really unclear. It's been demonstrated that a booster shot will give a person higher antibody levels. That is relatively meaningless. There are lots of viruses out there that don't really affect human beings, and you may contract them, but you don't feel any different. Nothing happens in your life and you move along. And so if I were to tell you your antibody levels were high or low, that's meaningless to you because you don't get sick. That tends to be the case with vaccination right now. You get vaccinated, you may get COVID, and you don't get terribly sick. If that remains the case, having higher antibody levels doesn't necessarily mean anything other than a lab test changes. What we want to see for ourselves and for our families is that we don't end up in the hospital, that people aren't dying needlessly. If it is shown that those boosters can prevent that, then yes, that'll be coming. That is probably what's coming in the future. As the virus continues to mutate, we're going to see, we've seen Delta now, there'll be an Epsilon and so on and so forth. When do we cross that line? When do higher antibody levels mean safety? At this point in time, I don't know. It might be in the near future, it might be months down the road. We might need a completely different booster to cover 4 different variants if the binding site protein changes.
Is there going to be a cause for concern going back to school this fall?
So the vaccine is available for 12 and up now, and it's expected that Pfizer will get approved for even younger ages in the relatively near future. So most, if not all, school-aged children should be able to be covered or potentially be covered with the vaccine. If the bulk of the school-aged children are vaccinated, there's not really cause for concern. You and I are both vaccinated, and we're sitting here next to each other right now, and we're not worrying about it. That same thing applies to children, and in general, children are at lower risk. I think the problem there is likely going to be community concern. It's normal for parents to be worried about their kids and what they're exposed to, and that's something that we as medical officials and public health officials have to deal with, and appropriately so.
Dr. Josh White, Chief Medical Officer here at Gifford, thanks for taking some time today.
Thank you.